Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Brandy Dailey, and she is the Director of Accountability and Community Response for the Arkansas Coalition Against Domestic Violence. Brandy, thank you so much for being here today.
Glad to be here. It's a pleasure to chat with you.
So let's start with the big picture. For those that may not be familiar, can you tell us about the mission of the Arkansas Coalition Against Domestic Violence and what your role entails?
Absolutely. So the Arkansas Coalition Against Domestic Violence, or the Coalition for short, was established in 1981 after a band of domestic violence shelters got together and realized more coordination needed to be in Arkansas at the state level for victim services in general. Over the years, the last 50 years, we've made a name for ourselves in our mission to eliminate domestic violence and promoting healthy families. And the way we do that is by training domestic violence shelters, law enforcement, judges, healthcare professionals, churches, schools, anyone in the community who is willing to listen about how we can improve our recognition and response to things like domestic violence, human trafficking, and stalking.
And domestic violence is often called a public health crisis. Can you explain how it affects both physical and mental health for survivors and even families?
Absolutely. So when we think about domestic violence, the easiest thing that comes to mind is broken bones, black eyes, bruises. But domestic violence is more than just physical abuse. Domestic violence often includes coercion, intimidation, threats, emotional, psychological abuse, financial abuse, isolation. And when you think about the impact all of those little things have, I say little, all of those things have on the human body and a family, you start to realize that violence at home has an impact to the entire community. Relationships, whether they're personal, professional, familial, platonic, they matter. And relationships impact our health. You know, if you've ever had a friend in your life who is really mean and says hurtful things and doesn't take accountability for, maybe they're constantly late, they forget your birthday and they're disrespecting your privacy, you wouldn't stay friends with them. You would call them out and probably enforce a boundary. But sometimes what happens is that relationship continues to fester. People might lose confidence, they might lose self-esteem, they might maintain that connection far longer than they really need to because of all the things invested, right? And when you think about bigger issues, mass shootings, violence at schools, we can often trace it back to domestic violence at home and how those relationships that were once loving have turned into toxic situations.
And in healthcare settings, what signs or red flags should providers be looking for that might suggest a patient is experiencing abuse?
So I think the number one is, can they be seen alone? If the patient comes into clinic and they have their partner or a friend following them around, they won't let them talk to the doctor one-on-one, that's a really big red flag. Right? Every person should be allowed to talk to their healthcare provider for at least 10, 15 minutes if they're going to the doctor completely by themselves. You know, it's common to want someone to come with you because medical scenes can be scary. But if you don't have control over that conversation or feel safe to do so, then that's a definite red flag. Other things to consider, medication management. If you have a client or a patient who has some disorder and they've been taking their medicine regularly, but all of a sudden they stop taking it. Maybe they're not coming to appointments. That non-compliance is not just the patient giving up on treatment. They could be in a new relationship where their partner won't let them go to the doctor or won't let them take their medication. Other things to note would be maybe insisting on paying in cash, not following through with medical orders, right? So maybe they come into clinic and they seem on board, but once you discharge them, you can't get in touch with them anymore. Are you allowed to get in touch with them? And so there's a lot of elements of where is that person's autonomy and who has power over them in the healthcare setting.
And once those signs are recognized, what's the best way for healthcare workers to start that conversation in a sensitive and supportive way?
So first and foremost, have that conversation alone. If you're going to talk about a patient's safety, it has to be out of sight and hearing from other people at the clinic. So if your agency is interested in being able to have those conversations, we have to take it beyond just having a screening tool or looking for a handful of signs. We have to think about when that conversation takes place. Do you have a shelter program to refer that client to? Or are you just asking for someone to say, yes, they're a survivor, and then throw your hands up and go, we don't know what to do? So see them alone. Have some sort of community partner, whether that's a shelter program, whether that's a community partner, right? Someone who offers resources to survivors, maybe someone experiencing homelessness. Just have that referral in your back pocket. So if the survivor, when you're talking to them alone, says, hey, I do want help, then you can have something in your pocket to bring out and offer those resources. Does that make sense?
It does. Education is such a powerful tool for prevention too. And can you tell us some of the educational programs that the ACADV offers?
Education and awareness are two big pieces of violence prevention. And what we do beyond training healthcare providers to recognize and respond to violence, we also have something called the CUES intervention, which stands for Confidentiality, Universal Education, and Support, which is an evidence-based intervention specifically for healthcare providers that we are beyond trained and familiar with. So if any healthcare provider is out there listening and they want some education, some formal training, and an evidence-based tool that can help promote referrals and survivors to seek safety, we have an example of those here with our safety cards that we can come and train on, and we teach you how to use these, right, as part of the CUES intervention. And it's really cool because every patient, once you see them alone, the policy will be to talk to them about how relationships can impact your health. And I'll hold it up to the screen. You can see it says here, is your relationship impacting your health? And all they do in the room is they take 2 minutes to open the card, walk through some of the questions, point out the free resources on the back of the card with all the different hotline information on there. And they give 2 copies of these cards to their patients. And it's not to identify someone as a survivor, but it's to say, hey, Robin, you might know someone going through a difficult relationship. And to better understand how your relationship impacts your health, we're giving everyone 2 cards. I'd like to give you these 2 cards. So if you know anyone experiencing this, you can pass this off as a tool. So all in one, you're getting some education and you're equipping the patient with the power of helping someone else. And that altruism is really what drives a lot of survivors to take a look at the card for themselves and consider, should they be the ones calling the hotline as well?
Such a great tool. How do they get them? Can they be dropped off? Did they pick them up? How do you get those in the hands of the providers?
So there's a few different ways that you can get your hands on these physical safety cards. Primary, go to futureswithoutviolence.org. We can link those in the comments or in a follow-up post. Futures actually is the one who created this intervention. They're the ones who've done all the research. So if anyone's interested in the citations for the studies that back up my claims of this being an evidence-based tool, please feel free to do so. I'll make sure to share information on that. But we also have a pretty good stock of cards here at our offices downtown in Little Rock. And I'm happy to share those with anyone who's willing to go through the 3.5-hour training that we provide, again, free of charge. We'll come to your program. We'll train the whole clinic on how to recognize and respond to violence. And then we'll make sure to leave a good stack of cards with us as we depart the training.
And do you partner, it's not just clinics, hospitals, schools to deliver these programs?
Absolutely. So we work statewide on systems from all shapes and sizes. That's probably one of my favorite parts of my job, is that I can work with a community of 300 or I can work with a community of 300,000, right? Depending on the scale and resources available in that area. So if you're from a community that has a school-based health clinic, or maybe you have a rural hospital, or maybe you're in an urban setting like Little Rock and you've got access to a lot more medical options, we're happy to come out and provide that training. I've trained nurses, I've trained pregnancy resource centers, I've trained hospital systems. A lot of this material was developed for community health centers or federally qualified health centers. And so there's a lot of prevention for primary care that we try to spread awareness of.
And are there any gaps in awareness or services that you're hoping to address in the future through your educational programs?
Absolutely. So I think when it comes to healthcare's response to domestic violence, there's actually a lot of information and training out there already on spotting the signs. And once you know the signs, sure, you can identify it. But what we ask providers is to go a step further and think about, what do you do when a survivor says, yes, they need help? If there's not a clear action plan, if that makes you question, should I be asking survivors if they're experiencing violence at home? Then that's where we come in. And we help organizations go beyond just screening someone for something they've experienced and really put together a better response package. Who are you calling into the room? Do you have backup resources? Do you have partnerships with different community organizations? And we work hand in hand with those agencies to build those relationships, so we have a much more sustainable intervention than just, hey, here's some cards, and until you run out, you're on your own.
And what's one key takeaway that you want every healthcare provider, professional watching today to remember about domestic violence?
I would say that you are already seeing survivors as your patients. They're already in your clinic. You've probably already seen them this week, and that there's more to be done. The doctor's office can be a safe place to have conversations about not feeling safe at home. But until our doctors do the work of educating on what happens beyond, I would rather they go through that and then start asking patients to disclose if they're safe or not, just to make sure that as a medical professional, they have all the tools they need before that conversation happens, versus waiting until it's too late and they have someone begging for help in office and they have no plan.
And for those that want to get involved, support your mission, or learn more about your training opportunities, where can they go?
So I would point you directly to our website, domesticpeace.com. On our website, we have a great contact us form that you can put your information in. We also have our info@domesticpeace.com email that you're welcome just to send a generic email request in. We are a small team, but we cover all 75 counties. So do not feel limited by being in a small town or a large area. We're more than happy to come to you and make it work to make sure this training and education is given to the community.
Well, Brandy, thank you so much for sharing this important information and for all you do for the future of Arkansas. Thank you.
Absolutely. I hope you have a great rest of the month.
You as well. And that's it for this episode of AFMC TV. Thanks for watching and have a great day.